Chapter 13 is mainly spinal cord. And these are the outcomes as usual. We're going to talk about the details of the spinal cords, including the arrangement, the function, the covers, and reflexes and other things. So remember, we talked about the structural organization or the anatomical division uh, of the nervous system. We said there is central nervous system and peripheral nervous system, and it's all about location. Central in the center, brain, spinal cord. Peripheral is outside, and um, reflexes. I talked about this a little bit before, which is this is the basic functional unit. Reflexes like this: you touch and move away. What happened in between those two? Many things. You touch, receptor, afferent or sensory, right? Control center. In this case, it's the spinal cord, but it can be the brain, right? And then it might be interneuron in between or not. And then you have the efferent or the motor until you go to the effector. Do you remember this? This is a reflex. This is the basic function of the spinal cord being like the supervisor of the body. Its work, most of it is like this. You do something and you react. Something is going to hit your eyes, you close it. Eye come to your eye, you close your eye, right? And so on. A lot of things are happening through this reflex, but once you see reflex, you remember receptor, afferent or sensory, control center, efferent or motor, effector. You have to remember this called reflex. So if this is happening at the level of the brain, we call it cranial reflex. If this is happening through the spinal cord, we call it spinal reflex. So the spinal cord is a continuation from the brain. Remember the skull? The skull is housing the spinal cord, the brain, right? Do you remember foramen magnum? This is where the spinal cord starts. And it will run within the vertebral canal. What's the vertebral canal? It is these vertebral, do you remember vertebral foramina? It's adding all these vertebral foramina to each other, making a canal. This is the canal that's housing, protecting the spinal cord inside. The spinal cord obviously starts right after the foramen magnum, right? Which is starting from C1, and it's moving down all the way, but it does not continue all the way to the end. It does not. It does not fill out the whole entire vertebral canal. It stops in between L1 and L2. So you mean there is no spinal cord after L2? Yeah, there is no spinal cord. It ends there. And so what about after that? What's happening? Yes, it's not empty. It's not empty. It contains the last spinal nerves. The nerves that come out of it will come together and fill the remaining part of the vertebral canal. Is that clear so far? So where does it end between L1 and L2? And just for your information to remember this, and I personally did that several times, do you hear about the spinal tap? If you want to get a sample of the CSF, this is where we go. Where I make like a mark in between those two pelvic bones, especially the crest, the pelvic crest. We make like a line like this, and this line will ultimately go somewhere under 2, like between 2 and 3. And then we insert a needle in the back, and with experience, it will pass the muscles and go in. We get a sample, and we put it under the microscope to give us an idea about the CSF, if there is like bacteria or virus or something like this. So where do we get that exactly? After 2. It's usually between 2 and 3. Why? No spinal cord. It's ended between 1 and 2. So from the beginning to the end, it will be divided into cervical region and the cervical vertebrae, thoracic region and the thoracic vertebrae, lumbar in the lumbar vertebrae, and sacral. Sacral is not in the sacral vertebra, vertebra, or it's not in the canal. It's just this is what we call it: cervical, thoracic, lumbar, sacral. Let me give you the explanation for that. When we're born, the spinal cord is filling the vertebral canal, all right, at the beginning, and then both vertebrae and the spinal cord grow. However, the vertebrae overgrow. So it's going like this. Look, like grow, both of them are growing. At certain time, this will speed up. So that's why it end up ending here. But we still call the four together when we started. Did you get my idea? It was like this: cervical, thoracic, lumbar, sacral. Yes, it is here. But as we grow, they grow together, and then the vertebral column is going to exceed the speed. It will go overgrow. So we still call the parts of the spinal cord same name, even though it's not located in that spot, not all of it anymore. Okay? If you look at the spinal cord, you will see it. If you cut it exactly in the middle, you will see right and left exactly the same. Mirror image. We call it bilateral symmetry. It looks exactly the same. What you see on the right is what you see on the left. And there are 31 segments, and this is something important to remember for the lab exam and for the lecture exam, both of them. Do you guys remember the number of vertebrae? How many cervical do we have? 7. How many thoracic? And how many lumbar? 5. Yes. Here, very close, but cervical we have 8 segments instead of 7. Okay? Even though it is 7 vertebrae, but the segments, we divide this cervical part of the spinal cord into 8 segments instead of 7. So 8 nerves coming out of it. How about the thoracic region? Just 12, normal. How about the lumbar? 5, okay? So 8, 12, that's 20, right? 5, 5, 1. 8, 12, that's 20. 5 lumbar, okay? That's 25. And then we will have 5 sacral segments and 1 coccygeal segment. That's total of 31 segments. It's divided into segments like this, 31. So it's not like 7, 12, 5. No, it's 8, 8, 12, 5, 5, 1. 8, 12, 5, 5, 1. 8 cervical, 12 thoracic, 5 lumbar, 5 sacral, and 1 coccygeal. Out of each one segment, there will be a nerve coming out, peripheral nerve. We call it the spinal nerves. So how many spinal nerves do we have? 31. How many segments? 31. Because each segment give you a spinal nerve. And if you look at the spinal cord itself, you will see something like this. You will see the spinal cord is like this. You will see like a sulcus here and a fissure here. Do you see this? There's a sulcus and a fissure. Posterior median sulcus and anterior median fissure. And you should remember that. I'm telling you that the spinal cord is like right and left. What's dividing it? Like how to know right from left. There is something dividing it like this. In the front, there is a fissure. In the back, there is a sulcus. To remember it, this is how I remember it, but you have to remember it anyway. I remember it P-SAFE, P-S-A-F, posterior sulcus, anterior fissure. P-SAFE, P-S-A-F, posterior sulcus, anterior fissure. Because you can be confused. Which is which? What is the fissure? What is the sulcus? P-SAFE. Exactly in the middle of the spinal cord, there is a canal at the center for the passage of the cerebrospinal fluid. And this is called central canal. Look at this here. Cervical, it's 8. Thoracic, 12. Lumbar, 5. Sacral, 5. And coccygeal, 1. Now, if you look inside, you will see what I just talked about. Look at this. This is a cross section of the spinal cord. You see how right looks exactly like the left? Do you agree? Look here. If you divide it exactly here, right is identical to the left. We call it bilateral symmetry. Bilateral symmetry. And look here, this is the anterior median fissure, and this is the posterior median sulcus. What's the difference between fissure and sulcus? Look at this. If I get a knife and do like this only, this is sulcus. If I go like this is fissure. The fissure is deeper cut. Okay? Where is the fissure? Anterior. Where is the sulcus? Posterior. This is what's determining right from left. This is dividing it. So if you look further inside the spinal cord, you will see the core inside is gray matter. Look how it's like H shape, like line, line, and line in between. This is called the gray matter. Outside of it is the white matter. Now you guys tell me, what does it mean, white matter? Somebody said it. Who said it? Myelinated? Yes, myelinated is a white matter. So the outside is mainly myelinated. The inside is unmyelinated, and that's why it's gray. And coming out of it are the spinal nerves, and they come from roots. The root that comes from the anterior part is called anterior root. The root that comes from the posterior aspect is called posterior root. They come together to make the spinal nerve. And look at this bulk here. This is the ganglion. Does anybody remember the ganglion? Yesterday, I just talked about it yesterday. What's a ganglion? A collection, not nerves. Cell what? Which part? Bodies. Yes, collection of cell bodies, isn't it? And which neuroglia is making it and keeping it? Yes, satellite cells. Did I mention that you will get 6 questions or 5 questions out of this? It can be more clear. I'm giving you the questions. Okay, not all of the questions, of course, but when I see something that's extremely important, I will tell you there will be something here to make sure that you get it. Okay, so I'm telling you, neuroglia, each one of those is important. She said satellite cells. You have to know that. Okay, so these are the ganglion, collection of cell bodies surrounded by connective tissue, made and maintained by the satellite cells. Now, the spinal cord is not really cylindrical shape. It's not like this. It's not like uniform diameter. No, in certain spots, it gets a little bit wider. Doesn't go like this. No, it goes like this, wide, wide. These are called enlargements. One of them is cervical, in the cervical region, cervical enlargement. One of them is on the lumbosacral region. We call it lumbosacral enlargement. Is that clear? It's not cylindrical shape. There are 2 enlargements. Why do we have enlargements? To accommodate more bodies into these areas. There are more bodies included in this. So the bodies in the cervical region are all these. You have a lot of cell bodies to go to your upper limb. Okay, in order to coordinate the upper limb, you need to have a big amount. So this area has to be enlarged. Same thing for the lower limb. In order to control the lower limb, you have to keep all these bodies somewhere. You keep it in that enlargement. The end of the spinal cord looks like a cone shaped. We call it conus medullaris. Conus medullaris. Now remember I told you that the spinal cord ending here at the tip of the conus medullaris, remember that it does not fill out the whole entire vertebral canal. We talked about this, right? So what's filling it? These spinal nerves at the end. They come together like this. They come together like this and fill up the remaining part of the vertebral canal. And they noticed that it looks like the horse tail. Those bunch of nerves at the end, it looks like a horse tail, cauda equina. Cauda is tail in Greek. Equine is horse in Greek. Cauda equina, the horse tail. You cannot say horse tail. This is a translation. You have to say cauda equina. And these are the nerves at the end. extending from the conus medullaris. The end looks like what again? Looks like a cone shaped. Is in the cone shaped, has a tip. The cone shaped end, it has a tip. From that tip, there is a tendon that starts, or a ligament starts from this and go all the way down to stabilize like this. If this is the end of the spinal cord looking cone shaped like this, from the tip here, I'm going to get like a ligament and pull it down, stretch it down so that it doesn't flip. Okay? This ligament at the end, or this film at the end, is called filum terminale. The film at the terminal end of the spinal cord. Filum terminale. Each one of these terms is important to know. Look at this here. You will see that the spinal cord ended between L1 and L2. You see this red? Can we see this red or pink right here? This looks like a cone shaped, conus medullaris. It ends between L1 and L2. How about the remaining? The remaining looks like the horsetail or cauda equina. The spinal nerves will have two roots, anterior or ventral, posterior or dorsal. What's the difference between those? Two differences between these roots. The spinal nerve looks like a tree. If you look at the tree, it doesn't have roots and then trunk and then branches. Same thing. The spinal nerve has roots, trunk, branches. Roots, anterior and posterior, or ventral and dorsal. What's the difference between those? Every one of those roots is carrying something different. The dorsal roots, or the posterior ones, carrying sensation going in to the spinal cord, while the anterior or ventral carrying motor command out. Do you remember that reflex that I talked about? Receptor, afferent. You go to the control center, efferent, effector. Do you remember this? Yes, they come together like this. Both of them, afferent and efferent, they come together to make the spinal nerve. So the spinal nerve is mixed. Are we following? Those two actually come beside each other, and we call those together the spinal nerves. But when you come here to the roots, one of them is bringing the sensation. Which one? The dorsal. And the other one is carrying out the motor command. Which one? The anterior. And the other difference is only the dorsal one that has a ganglia, the dorsal or the sensory one. Look at this picture here. You see how the anterior, there is nothing significant here. It's just an anterior. And look at the dorsal one, it has the ganglia. And this will be one of your ways in the lab to know anterior from posterior, dorsal from ventral. How to know? There are many things. One of them is you will see the fissure in the front and the sulcus in the back, but this is not the clearest one. The easiest one to tell is the presence of this ganglion only in the posterior. So if I'm asking you which side is posterior, this or this? This one here. How did you know? The ganglia is here. Clear? Spinal nerves are called mixed nerves. Why? Because they carry both sensory and motor. This is for the spinal nerves. The spinal nerves come from the spinal cord, isn't it? Spinal nerve communicate with the spinal cord, right? What do you call the nerves communicating with the brain? Not brain nerves. There is a name for it. Start with C. Oh, you said cranial? Oh, I didn't hear. Okay, cranial nerves, right? Spinal nerves are mixed. Spinal nerves are mixed. How about the cranial nerves? No. Cranial nerves, some of them are mixed, sensory and motor. Some of them are sensory only. Some of them are motor only. But if I ask you, spinal nerves, are these sensory or motor or mixed? Mixed. All of them are mixed. Why? Because it carry both sensory and motor neurons. So now we have the two roots. Following? Anterior root, posterior root. Anterior root motor, posterior root is sensory, right? They come together to make that mixed spinal nerve. So this is a tree: root, trunk, and then branches. Branches in Greek, ramus. So we have the rami, anterior ramus and posterior ramus. Is the anterior ramus and posterior ramus like one is carrying sensation and one is carrying motor? No, it's different than the roots. Now they are together already. Actually, the posterior ramus or the branch will feed the muscles of the back, while the anterior ramus will feed everything else. This will give us an idea here that the posterior branch is smaller. Okay? Why? Because you're only giving the muscles of the back. That's it. But the anterior one is giving the whole rest of the body. It has to be bigger. So if I ask you which one is bigger and why, you should know. Now, naming the spinal nerves can be a little bit confusing. Why? Because do you remember there is a vertebra and a vertebra, and there is intervertebral foramen? Do you remember this? This opening in between each two. So when you come out of this, how can I tell like which segment? Like you are in between C1 and C2. Like should I call you 1 or 2? You are in between, right? So how can we name it? I will tell you that the confusion only is in the cervical region because we have 7 cervical vertebra, but we have 8 segments and nerves. So this will give us the confusion. What's the confusion here? In the cervical region, the name comes from the vertebra underneath. This is C1. So what do you call the nerve above it? C1. Between 1 and 2. Is it 1 or 2? 2. Between 2 and 3, 3. Between 6 and 7, 7. Between 7 and T1, 8. 8. And this is the extra one. Anything else will be named after the vertebra above it. Did you get the idea? So, sometimes they give that in the lab, a lot of times. They give one of these nerves and they put a sticker on it and they ask you which spinal nerve is this? And you see it coming in between two vertebra. How can I know? Like it's between, like you can count. Like if it's in the lumbar region, for example, okay, it's very simple. This is L5, L4, L3, L2, L1. Okay, that's the easy part. I can count. And I see it coming from between L1 and L2. Which one is it? I don't know. It's in between. How would I know? Right? Now, the way to know in the cervical region, the name comes from the vertebra under the nerve. This is in the cervical region only. Anywhere else, it comes from the vertebra above it. So what if you see it between L1 and L2? What do you call it? L1, okay? Between L2 and L3, L2. Did you get the idea? This is the only difference between the cervical region and otherwise. And you can be asked about this in the lecture. And in the lab, they put a sticker on these nerves and ask you which nerve is it. You should be able to know. Okay, see how the exit? So look at this, C6, because this one here underneath is the vertebra number 6. While anywhere else, starting from T1 all the way to the end, the name come from the vertebra above it. So this is like count here. You see this is L5. You see the green above it? This is L5. So the name come from the vertebra above it. Last thing that I will be talking about today is the meninges. And meninges is not something hard. It's like this. My skin is covering my body, right? It's adherent to the body. And then I'm wearing an undershirt. And then the shirt. This is 3 layers, right? The first one, which is my skin, it's actually adherent to the body. The spinal cord, there is a layer adherent to it, just like your skin. And this is called the pia matter, the pia. And then my undershirt, is called arachnoid. And then the shirt outside is called dura. So the arrangement of these layers is pad, P-A-D. Like, you know, the iPad, P-A-D. Pia, arachnoid, dura. Okay? Pia, what does it mean? Pia means delicate. This is the one that's adherent. Adherent. So it has to be delicate, right? Arachnoid is in the middle. How about dura? Dura is coming from durable. What do you think? If you're wearing a jacket, isn't this is the most durable? Is it more durable than your shirt and your undershirt? The outermost should be durable because, practically speaking, this is the one that's facing the bone. It has to be very tough or durable. While the pia mater is facing the delicate spinal. Did you see the spinal cord before? Did you see how it looks like? It's jello-like. Like we do gross anatomy at University of Detroit Mercy School of Dentistry. We do actual dissection, and I always tell the students, don't push it too much. If you just push the spinal cord a little bit, it's fragile to break down, just like the jello-like. So the pia mater has to be very delicate. Pia, arachnoid, dura. There are spaces in between those layers, and I'll talk about this next time.